All right, this is week 4 of our Climate and Health Advocacy Boot Camp that is being co-hosted by the Global Consortium on Climate and Planetary Health Education and the Medical Society Consortium on Climate and Health. And I'm Lisa Patel, I'm the Deputy Executive Director for MSDCH. So we've done 3 sessions so far on how to write your narrative, on connecting with your audience, with our media folks. Last week, we heard from people from VoteER and the Environmental Voter Project on the importance of turning out the vote during this election year. Today, we're going to be focusing on finding your climate community. Just a few reminders, the readings and recordings are available on the website. Haley will be putting the link in the chat right now. We'd ask you to please put your name and location in the chat. Please put questions for our speakers into the chat. There'll be a portion of today's program we'll really have an opportunity for Q&A with our wonderful speakers that we have today. And then please keep your microphones muted, but we do invite you to keep your cameras on so it can feel like we're talking to people as opposed to into the void. I'm super excited today. We were thinking about 4 people across 4 different parts of the climate and health advocacy landscape that inspire us. And we're really, really grateful to be joined by Dr. Lori Byron. She's the chair of the Montana Health Professionals for a Healthy Climate, in addition to a lot of other roles that she plays. And we'll be putting the bios for each of our speakers into the chat because I can't do it justice in just these few lines. Dr. Amy Collins, she's the medical director of physician engagement and education at Healthcare Without Harm. Dr. Armin Henderson, he's an assistant professor of medicine for the University of Miami, a former Chef Fellow for the Medical Society Consortium, and Carly Hampshire, she's a 4th-year medical student at UCSF and also the founder of the Planetary Health Report Card. Before we get to the panel, though, we're going to do a quick orientation session in terms of the ladder of engagement, in terms of how, as advocates, you can come into the work and how you can build your skill set that Bev and Nicole will be leading. Then we'll turn to our panel conversation. Then we'll do some breakout groups led by Bev and Nicole, and then we'll come back, as we've always done, and digest some of our learnings. And with that, I'm going to turn it over to Bev and Nicole.
Thank you, Lisa. So before we hear from our really excellent panelists, we wanted to just give a little background on our theory of change, kind of an overview of the menu of the ways to find your climate, health, and community, the different communities and groups that exist. Then we'll hear some real life examples of folks who are leaders in those communities during the panel. So this is our first. So why do we want you to find your climate and health community? We've talked to a lot of this in previous sessions, but really the reason we are so excited you're all here today and want you to find a place to be consistently engaged is because we know that your voices, engaged with policymakers, engaged with the public, is going to get us to our goal, which is the implementation of climate solutions and policy that protect and promote the health of our communities and future generations to come. So you can see in our little theory of change graphic that our health voices find their communities, whether it's in the member societies, state advocacy groups, community level advocacy, and then through that work influence the public, influence policymakers. We also do direct action with policymakers. So all of these amazing climate and health communities are making this happen, are making the gears turn toward our goal. So there are a lot of different pieces that go into this work and a lot of different ways you can help turn these gears. And there are levels. And and all of these levels are incredibly important and very valid. And as you are at different times in your career and your life and whatever is going on, you might move up and down this ladder of engagement. But we have at the bottom, if you're newer to this space and just wanting to learn more about a specific area of expertise you're diving further into, you're going to be following, subscribing to newsletters, just learning more about the topic. And then as you move up, maybe you're really consistently responding to our sign-on letters, you're responding to actions, you're sharing materials with colleagues, you're sharing materials on social media, you are kind of like getting engaged at an educational level. And then kind of the next step is where we're hoping to support you all today to maybe take some steps into is joining a group and engaging at a more consistent level. So whether we have, some really incredible state level climate groups, we have other national efforts happening, but joining a group of people doing this work and getting involved. And then on this call today, you're going to hear from some amazing leaders, people who have at some point moved up this ladder and are now leading groups and really kind of have ownership over a body of work, and are also doing the next level, which is building up the groups, building up the infrastructure to bring more and more people in and support them to be doing better, more strategic advocacy, more strategic educational efforts to move us to where we want to go.
So I'll jump in now. My name is Nicole Duritz, and I am the Director of Advocacy and Outreach for the Medical Society Consortium on Climate and Health. And, as you're thinking about the ladder of engagement, and again, I want to reemphasize what Bev already said, which is moving up and down that ladder is very acceptable. It's what we all do in our advocacy efforts. But you might be wondering, well, where can I go to take these actions? And in different areas, what are the opportunities? And so we created this slide. And all the slides, again, will be available following this session. We created this slide just because we wanted you to see that there are a lot of different ways to engage. Within many of you are members of your national medical organization or your specialty societies or even a state organization society. And one thing you can do is talk to your friends about the work that you're doing, why you're passionate about making sure there are policies that are advancing to protect our health and to protect and to address climate. So something you can do is just talk within your friend group. Or there are folks that we've worked with that have developed their own continuing medical education courses. That is a great way to get people engaged because they know everyone has to get their continuing medical education credits and creating something that is showing the connection between the work that you do and medicine, and how it interacts with climate is a great way to attract people. Again, Bev talked about in medical societies, maybe you're going to be part of the leadership so that you can move your organization in the positive direction to engage. Lots of different things. Some people don't want to be out front in a way where they're having to talk to people directly. Maybe you're a little bit more of an introvert. I can fall into that category often, but maybe you are comfortable writing and having your name attached to a journal article on an issue or an op-ed. Again, there are lots of ways to engage just within your medical society. Again, you're going to hear in a little bit from folks that have worked in state groups. Maybe you're just coming into this work. So joining a state organization that is working on these issues is a great way to meet other people that are part of the community and to learn more about the issues. You can decide that you want to work on educational efforts, or maybe you're going to dive deep into the policy. Again, it's up to you. Maybe you're just, again, going to pull people in for the discussion and do some recruitment. At the national level, there are many ways to get engaged. At the Medical Society Consortium, we have an advocate list, which we engage people to sign up, and we'll put that link in a chat sometime during the session. We'll send out alerts to advocates, letting them know something is happening on Capitol Hill that we think requires their attention, that we want to make sure lawmakers or candidates for office are aware of the policy connections and the health implications. And you can just sit down and write a letter. I used to call it accidental advocacy. You might do something when everybody in your house is asleep, or maybe you're on call and have a break. You can go online, you can write a letter and send it off, and we'll help it get to the person that represents you. For those of you who are ready to be more out front, for example, the Medical Society Consortium has a rapid response training program, which helps people learn to talk about these issues, to tell their stories to the media. Another great way to engage. Or again, if you're in that learning phase, you might just want to participate in a webinar or a CME course. All of these are incredibly valuable. And then within your own health system, we have a group that just started in Idaho. And they have had their health system sign on that they're going to become more sustainable. And you can advocate within your health system with the administration of your hospital to move in a positive direction. Maybe you're just going to let your patients know how important it is and the impacts on health and the climate connection. All of these opportunities are fabulous ways to engage. And again, whether you're just learning or you're talking to your friends, or you're starting a new group. All of these are incredibly valuable and important opportunities. So the next slide, well, we'll turn it over to the next slide. And what we were trying to do is let you know that people are coming in at different points in their career. So here's an example. Bev created these slides, which I think are fabulous. So maybe you're an ophthalmologist in middle career, you're in Indiana, and right now what you're doing is you are reading the newsletter. MSCCH just sent out our monthly newsletter, and it's chock full of information. Again, we're going to provide a link so you can sign up, and it's an opportunity to kind of learn what other people are doing, read interesting articles, learn more about the areas. Again, you could sign on. Sometimes this mid-career individual is pretty busy, lots of on call. And so what are they doing? Well, they're writing letters to Congress, signing petitions where they have time. And they did decide to go that extra mile and join an annual meeting and participate in a Hill Day. And those are all things that are incredibly helpful. Our next person is an early career physician. So maybe they're just applying or they've become a family physician. They're new, and what they're doing is learning more about what the American Academy of Family Physicians is doing on climate, and they're engaging. Maybe they've attended a workshop on how to write an op-ed. We're holding one tonight. And maybe they've joined their local state organization. Climate Health Now is an organization that we have that we work with in California that's doing amazing work. All of these things are ways to engage. I'm going to turn it over to Bev to give a few more examples.
Thanks, Nicole. And thank you for the spell check on ophthalmologist. Appreciate that. We do love these slides and I want to keep using them. So, okay, so this is kind of the next level. And we have an example here. This is our mid-career nurse practitioner in Georgia. They've been in the climate movement for a little while now. They've been engaging in climate and health for a few years. And they are now a leader of their state group, Clinicians for Climate Action in Georgia. And they're coming on our calls, and they're coordinating with other state groups on some national policy efforts and educational efforts. And they also are at a point where they feel like they want to talk to the media about climate and health. They feel comfortable with that. So they have decided to participate in our climate and health rapid response media team. So this is kind of like another level. And after that, I guess this is really kind of obviously founded based on someone who's on this call. But this is, you're going to hear from her, Lori Byron, but she's such a great example of someone who's done so much incredible work and founded a Clinicians for Climate Action group in Montana. And she's a really strong national spokesperson, prolific in op-ed writing, has been doing really powerful structural work and organizing within her medical society, AAP, and is also at a point in the career where, dedicating a lot of time and a lot of full-time capacity to this work. That's really funny. I didn't put together that Lori was going to also be speaking on this call. So those are just some examples of based off of some real people or made up people of kind of who these individuals are out there in the climate and health world and what communities they're part of. And so I referenced here our state groups, which at the consortium is kind of what we see. These are our strongest climate and health communities, and the best way to get plugged in and stay plugged in to consistent efforts, especially at the state level, but even beyond that. And so at this point, we have more than double this amount of logos. These groups have been growing incredibly quickly. A few of them predate the consortium, and we'll share some more information about how to go about plugging in and finding these organizations. But we really see this as kind of a premier home and place to be involved and find community. So I think that's all we're going to share for now, but we will come back and talk a little bit more about taking your first steps and plugging in directly after we hear from our panelists.
Great. Thank you so much, Bev and Nicole. And so we have our panelists here. So why don't we start off I wanted to first hear, maybe we'll start with you, Amy. Can you tell us a little bit about your work in terms of how you got involved in the climate movement and the area of the climate movement where you now spend most of your time?
Sure, I'd be happy to, and I knew I was going to be first. My journey started back in 2007. I was in the school pickup line, idling, texting, and listening to music, waiting for my 4th grade son. He came out of the school, opened the car door, and reprimanded me for idling. His teacher had read him a story about climate change and polar bears, and he made me promise to never idle again. And to do what I ever could about climate change. I'm just gonna take one sip. Apologies, I had COVID and I still have a hoarse voice and sometimes I have to catch my voice. So we did whatever we could do at home, and then it became very uncomfortable living one way at home and another way at work. I started to wonder why I left my environmental conscience at the door, and I started noticing all the waste and inefficiencies. I got educated. I learned that healthcare had a big impact. I became increasingly concerned about the impact. So I then wrote a letter to my administration asking for permission to start a recycling program and a sustainability team. And I was given almost instant permission. I led the sustainability work at my 2-hospital health system for about 7 to 8 years. And that is really how I got started in this journey. And it eventually led to me making a pitch to Healthcare Without Harm to support an initiative to support physician engagement. Worked initially as a consultant, and in April started with them in a full-time capacity, supporting our physician network, which is a network of physicians and medical students interested in promoting climate smart healthcare and other climate solutions.
That's great. That actually transitions perfectly, I think, maybe to Carly to talk a little bit about how you got into this work as well, from the student perspective.
Thanks for sharing that really lovely. Not wanting to check your environmental consciousness at the door. That really resonates. Great to be here with you all. Thanks to the Global Consortium and Medical Society Consortium for inviting me to speak on my favorite topics, climate community. And in terms of how I got involved in this work, when I was attending college at Emory, I spent a lot of time doing educational and health-related service work in the refugee and immigrant community of Clarkston, Georgia, which is sometimes called the Ellis Island of the South because of how much of a global melting pot it is. And part of that service work included volunteering at the local community health center as a phlebotomist, or someone who draws blood. And I was making chit chat with one of the clinic patients, a Syrian refugee, one day before drawing their blood, as I always did. They made this offhand comment. We were talking about the war in Syria, and they said, well, you know, it was really the drought that caused all the problems. And that comment really flipped a switch in my brain. And that night I went home and got myself into this deep internet rabbit hole about climate change as a root cause, an underappreciated driver of displacement, immigration, and conflict. And I began to see climate change as this great exacerbator, this insidious threat multiplier of all sorts of inequities and societal issues, whether displacement, homelessness, racism, et cetera, and how downstream of all of that is health. So in medical school at UCSF, in the spirit of an ounce of prevention worth a pound of cure, decided I wanted to go way upstream and make climate action my main focus. And yet, starting out medical school, it seemed like the intersections of climate change and health were really lacking in our curriculum. And even when wildfires were raging all around us and the air quality in the Bay Area was absolutely toxic, there was a disconnect between what we were learning in the classroom and what was happening in the outside world. And that gap inspired me, with the help of several other classmates and wonderful mentors, to found the Planetary Health Report Card Initiative, which is a tool and network that essentially has student-led faculty mentoring teams evaluate their institutions based on metrics across 5 categories: curriculum, research, community outreach and advocacy, support for student-led initiatives, and campus sustainability. And along the way, identifying gaps, hopefully using the results to design institutional advocacy efforts. And then annually on Earth Day, we publish the summary reports on our website, phreportcard.org. So encourage you to check it out. And the initiative started off in 2019 as a pilot at just UCSF and Stanford, but now is in We're medical schools in 8 countries around the world with recent launch of report cards in pharmacy and nursing. So to come back to your question, I would say climate and health education and community building and mobilization of global health professional students for planetary health is where I spend most of my time these days.
Both really powerful stories in terms of, what your experiences were, who you were, and how you processed what you were seeing in the external world from either the people you cared about or the people you cared for, and carving your path. Armin, I know you've done a lot of work at the intersection of health equity and justice and climate change. I'd love to hear a little bit about your journey.
Yeah, can everybody hear me, by the way? Okay, great. Yeah, thank you again for having me. I want to iterate, I love having conversations like these. Basically, I want to, my journey started, I guess, when I was watching Hurricane Katrina unfold, and the response to vulnerable populations, particularly Black populations in New Orleans, and how New Orleans really never, the Black population, of poor individuals, how they were considered refugees in another state, collecting stories from individuals around that, and then going to Haiti during the 2010 earthquake, maybe like a month or two afterwards, and setting up, remote clinics in areas that were really affected by the massive flooding or the earthquake that took place during that time. And then moving from medical school, actually in medical school, experiencing a great flood in Nashville, Tennessee, where I was a medical student, and the recovery efforts around that. Then moving to Miami, Florida at the helm of climate change and experiencing my first hurricane here, Hurricane Irma, which was in 2017, and how all those pretty much led me to get with individuals who are on the ground, who take care of vulnerable communities every day, and to develop what we call a disaster relief network called the Community Emergency Operations Center. And through the fellowship that I did with the Consortium on Health and the National Medical Association and the Climate and Health Equity Fellowship, really operationalizing it to give other communities tools about how we developed our network, how we develop our relationship, and really what goes into programming around or starting a community emergency operations center where they are, but also, tailoring it to the needs that we have specifically here in a place like Miami, and connecting the dots, not only between, natural disasters that occur, but also man-made and human disasters that pretty much promote the same after effects that something like a hurricane would. And treating those as such as well. For example, the deep freeze that happened in Mississippi and how, in Texas, and how the flooding that resulted from that is produced similar effects to individuals who are experiencing natural disasters as well. So that was full circle for me. Just wanted to keep it short.
Great. And, we've talked about the vulnerability of populations. So whether it's immigration, whether those that have been made disadvantaged by structural factors like racism and poverty. Lori, I know you work in an area that is rural and doesn't often have access to care. And I'm curious about your journey as well. Did that play any piece of it? Or if you could talk about your journey in climate and health.
Thanks. Well, so far. 14 years of homeschooling our girls and doing a lot of environmental projects for science fairs, prompted my husband, Rob, who's an internist, and me to delve into climate issues. We realized that the decades of gain in public health that worked all our life, all these measures would be lost if climate change wasn't addressed. So we semi-retired early to volunteer in this arena about 10 years ago. And we ended up leading the health team for Citizens Climate Lobby and working with the Medical Society Consortium and some other national groups for several years. But after doing a good bit of lobbying in DC, we realized that our individual Congress people really didn't care what the American Medical Association or the AAP had to say, but they did care what their constituent healthcare providers had to say. So my husband and I founded the Montana Health Professionals for Healthy Climate so that the healthcare professionals in Montana could possibly influence our Congress people. And it quickly became a full-time job for us. But also the DC work made me realize that pediatricians could have a really great impact at the state level. And this state level climate and health work wasn't really being done by any of the major medical societies that I knew of. the AAP had a lot of national action, but really nothing at the state level. So we jumped through the hoops with the Academy of Pediatrics to get approval. And then we found one or more pediatricians in every chapter in the United States to be climate advocates for their chapter. We now have about 140 of these advocates. And we meet monthly to hear a great speaker, like Celia or Carly, and discuss what everyone's doing in their states. And it's been a kind of an organic process, and the group has accomplished a lot of action in the last few years.
Great. It's been so great to hear each of your journeys and how each of you, found a specific problem or a specific issue, whether it was structural or community oriented, and then oriented your approach around it. I'm curious now, maybe we'll start with you, Carly. What have you found most challenging about this work as you've been navigating your place in the climate movement?
Yeah, I think there have been a lot of challenges. This movement is just getting started, and so we're just growing and learning together. But one challenge for me has been that I'm a very tangible, action-oriented person. I'm the one in meetings that wants to talk about deliverables and dividing up the to-dos. I don't do very well with abstract conversations and talking in circles where there's no clear next step, which often is necessary when you're thinking about strategic development of an organization and a movement. But coming to the climate space, I felt like it was so huge and complicated and abstract that it was hard to know where to meaningfully, tangibly plug in, especially as a student. And companies telling me to buy this or that greenwashed product or reduce my own carbon footprint in small ways seemed like relatively trivial action items in the face of what was at stake and the ways that our society would need to fundamentally change to address this crisis. And so I think developing the Planetary Health Report Card was a way to define a little bit more, not just for us at UCSF, but as a shareable tool around the world. Like, what does an ideal climate change health curriculum look like? And what are some specific planetary health student opportunities that it would be great for institutions to offer? I hope that, that having those report card metrics and the community to bounce ideas off of makes it a little bit less intimidating and complex and vague for other students, especially students early in medical school who are just getting a sense of who the players are. And then the other is many students are in this audience, but being a student in this space can be at once empowering with the focus on youth voices, but also especially when you do institutional advocacy and trying to inspire movement without pissing anybody off or sabotaging my own. I'm sure that could go is more senior either, but definitely hierarchies at times, especially when it comes to being in the hospital. And as a lowly medical student, not feeling the autonomy to include sustainability in my practice patterns. So if everyone else on the team is putting on gloves, is my internet unstable?
Yeah, maybe
Okay.
just stop your video, Carly. Yeah.
Okay, sounds good. Sorry about that. I think I was saying it's hard being a medical student in the hospital where I don't feel like I have control over my practice patterns. So if everyone else on the team is putting on gloves to do a physical exam, even if it doesn't really seem necessary, I don't feel like I have the option to not wear gloves without getting some weird looks. But as I mentioned, this climate and health movement is getting started. We're all learning other training we're at. And so because of that, I feel like the student faculty hierarchies exist perhaps less here than in other spaces. There's a lot more openness to collaborating with youth.
Great. Thank you, Carly. And that statement about the problem felt so big and it felt hard to know where to make an impact really resonated, because I know I certainly felt that way when I got started as well. Maybe Lori, we'll go to you next in terms of what you found to be the greatest challenges.
Well, Rob and I were super lucky to have already raised our kids and to be able to get back on work. We became passionate about this topic. And I realize it's much harder for early and mid-career providers to carve out time. Honestly, though, just having enough time is the biggest issue for me. Even though I am semi-retired, there's always more to be done. But I also must say that everything that we do, the vast majority of people, whether it's patients or other healthcare providers or people that you give presentations to, are really grateful for our work on climate change. And that's super encouraging.
Yeah, the time issue also resonates. I have two young ones. Amy, I saw you nodding as well.
Yeah, first on my list was time, and I think keeping up with the momentum. throughout most of my sustainability journey, I've tried to balance the sustainability work with working clinically. And it was really hard to find the balance and dedicate the time to sustainability work. And it's really keeping up with the momentum. The story I share is when I went to my first Clean Med conference, which is our annual conference about sustainable healthcare, I was the only physician there. And I think about how, actually, I've learned Mona Sarfati was actually there. So interestingly, the two of us were the first ones there. And when I think about how the physician and clinician climate and sustainability movement has grown, I've had a hard time keeping up with it. And, you know, I think the other challenge is prioritizing opportunities. I learn of new opportunities, you know, weekly. They're all fantastic, but, you know, how do we prioritize them? So I think, you know, I agree with Lori, finding the time, even though I now do this as a full-time basis, I still don't have the time to keep up with it. I think because the movement is just, you know, growing, and there are more and more people who want to get involved in this space. So I think time, prioritization, and again, just keeping up with this incredible momentum. And I'll just add, I think another challenge is has been trying to engage more people. You know, I have my messages, I'm, you know, I do a lot of speaking to audiences, trying to engage people. I've learned to be happy if I engage 1 or 2 people after a talk or some sort of outreach. But I've found it a little bit frustrating that haven't been able to engage more people in this space, you know, understanding that there are just so many other calls to action for physicians and other health professionals, and this isn't going to be everyone's issue.
Great. And Armin, I saw you nodding as well. Did you similar challenges that you faced or different ones?
Yeah, I think a lot of the challenges that that I run across through this work in environmental justice is it's really around the frustration that because I work a lot in disaster, is a frustration around the fact that the National Advisory Council was created to give recommendations to FEMA, and they've done so since 2005, that so that it wouldn't happen again. And yet every disaster that plays out, whether it be here in the United States or in the poor global South, the same vulnerable communities, the same things just keep on happening. And they're actually starting to get worse now as well. And so, you know, the need to create this sort of coalition of community members that responds to their own community is something that was born out of necessity, because we've understood that our local governments, they don't know how to respond to us. They haven't known how to respond to us. And with climate change and the worst disasters that we're going to see, the worsening disasters that we're seeing, just knowing the people that are going to be at risk for increased morbidity and mortality is really sad. The other thing that's really hard about this is how to communicate that that our war industrial complex is one of the main drivers of climate change in the United States and in the world. And if we were really concerned about climate advocacy, we were concerned about you know, disaster-related effects and really slowing it up, we have to be concerned with world peace. And that's something that has traditionally got a lot of people in trouble. That's some of the reasons why a lot of climate activists get killed a lot of times. And so people are putting their lives on the line to make sure that this message is out there. And yeah, so.
That's really powerful, Armin. Yeah, and that's one that I think doesn't come up often enough, and is a very important thing to consider as we consider about the drivers of climate change. So we talked a lot about the challenges. Now I want to move over to what's rewarding about this work. And Lori, I'll start with you.
Thanks. Well, coming back to the state level, both with our Montana nonprofit and also working with pediatricians who are working at their state level has been immensely rewarding. Also, seeing how many of the traditional environmental groups are now pivoting to research health benefits is really satisfying. I'm not sure if it was we as healthcare providers in the climate change movement that created the concept that human health is now the face of climate change instead of polar bears, but the effects on human health is undoubtedly affecting the climate change movement for the better. And I think that, taking action just generally makes us feel better. I love Nicole and Bev's examples, and I'm not even sure that moving up and down the ladder is a way to do it, because they maybe would have described their easiest step as joining the Medical Society Consortium. If I had a 10% of the healthcare providers in Montana join our state group, I would be over the moon. So any of these actions are super important.
How about you, Amy? What's been rewarding for you?
I mean, I found this work incredibly rewarding since I first started doing it. I think for me, it's been my wellness. It often doesn't feel like work because I really enjoy doing it. I think it helped me avoid burnout. I mean, I worked clinically for over 30 years. And I think it was really valuable for me having mission-based work in addition to clinical work, and it kept me going. I left clinical medicine largely in April, but it was not because I was burned out. It was because I think I had, better work to do, and there was better use of me at this time in my career. But I think it helped avoid burnout. And I think the other thing I find rewarding are the people. I'm incredibly inspired by people like all of you who, in addition to your school responsibilities and clinical responsibilities, are taking time to make efforts within your schools or your medical societies or your communities. I particularly find the work that the medical students, the next generation of healthcare leaders are doing, such as Carly and Medical Students for a Sustainable Future. And I just really enjoy working with, my people. I think we speak the same language, we have the same values and priorities, and I think it's just a terrific community of people. I think the other thing that I find rewarding is that at Healthcare Without Harm, we've been working on these issues for almost 30 years, talking about climate change and the imperative for the healthcare sector to reduce emissions and prepare for climate. And finally, after all these years, we're seeing some momentum with the HHS pledge and the NAM collaborative on decarboning the healthcare sector, some executive orders. So that is rewarding. It's a little bit late, but it's very rewarding that we're seeing action now.
Great. So we've heard the rewards in terms of community and the feeling like finally our message is resonating and we're seeing some real action. Armin, how about for you? What's rewarding for you in this work?
I think the one thing that's really rewarding is seeing community members that we've trained across the country who want to do the similar work that we're doing in Miami and throughout Florida of responding to vulnerable communities during disaster. When they pick up what we've created, the tools that we've created, the educational opportunities that we provide, the workshops that we do with other organizations that are responding to vulnerable communities in other places, just seeing them come alive, developing a network across the United States in which we're able to respond sometimes, days or, weeks faster than the local, state, and federal government to individuals experiencing, trauma related to disaster. And also, the people who come up to us when we are responding to a disaster, who tell us, we thought that people forgot about us, that our voice wasn't being heard, and things of that nature. I think that those are some of the more rewarding moments for me.
Great. And so really doing what we can, understanding that climate change makes vulnerable, entering those inequities and empowering people in terms of their health. And Carly, how about you? What's rewarding for you?
Yeah, similar to what you said, Dr. Collins, about people, and what you said, Dr. Henderson, about the network building, I would say collaboration, like the collaboration of institutions across countries, across professions, and collaborations between youth and organizations, with the urgency that there is surrounding climate change and environmental degradation. We don't have time to reinvent the wheel. We don't have time to keep our initiatives siloed. And I think people in this space uniquely understand that. So there's this real sharing culture, this sense of we're all in this together and for good reason. So let me just give you everything I possibly can.
Carly, you might want to
doing what you're Okay, sorry. Sharing culture of let me give you everything I can to maximize your success. And I think that people particularly embody the spirit. Sorry about all the problems with the Wi-Fi.
Now, just thinking through some concrete opportunities. We've had this group of very dedicated advocates that's been joining us week after week. And so I'd love for you to get personal about your work in terms of talking about how could people potentially join you or an organization that you work for to contribute. And Armin, I'll start with you this time.
Yeah, I mean, I'll say that you can reach out to us. The organization that I started in Miami is Dade County Street Response. Outside of curricula building for the residency and the medical students, we're also involved on a national level with our partners like Movement for Black Lives. And if you're interested in learning more about how we operationalize our Community Emergency Operations Center, then I'll put a link here to the guide that I created as part of the Climate and Health Equity Fellowship that gives you a little more in-depth information around why we started it, the goals of why we started it, and how medical professionals at any level of their career can get involved, even where they are with what they have. So I think that that's important, and I'll leave it here in the chat.
Great. How about you, Amy?
There are lots of opportunities. We know that the healthcare sector is responsible for 8.5% of US greenhouse gas emissions. We know that the clinical care is the greatest contributor to healthcare emissions. And I think we also know that to meet the goals of the Paris Agreement, all sectors, including the healthcare sector, need to reduce emissions by 30%, 50% by 2030 and achieve net zero emissions by 2050. If the healthcare sector continues on a business as usual scenario, emissions are going to actually triple by 2050. So in order to meet that goal, we really need action from every health professional in every health institution around the world. And we know how to get there. We know how to at least get to reducing emissions by 50% by 2030. And I feel, strongly that physicians and other clinicians and all health professionals, have an ethical obligation to, try to do their part and reduce healthcare's contribution to the healthcare sector, to the climate crisis. I think there's no one way for people to do that. I think, you can look at your clinical practice through a climate lens and make clinical decisions that are environmentally preferable. You can take action within the four walls of your health facility, asking your leadership to join Practice Green Health or sign the HHS pledge or, start a sustainability program. You could start a departmental program like a Greening the OR program. There's lots of need for research, healthcare emissions research, so we better understand the impact and where to focus our efforts and get data to allow health professionals to make evidence-based decisions. Talk about climate smart healthcare, talk about it in blogs and newsletters and op-eds and, during rounds. Write letters to the editor. I think there's lots of opportunities to communicate about this and engage the media, include it in educational programs, in grand rounds. There's a lot of effort around climate curriculum, and I think there's an opportunity to bring this into curriculum. So I think everyone has a role, but no two people's role is going to be exactly the same. But I think everyone has, an opportunity to do their part and help reduce healthcare's emissions.
And just one more question to build off of that. We have a number of participants here who are international, and I understand Practice Green Health works internationally. Is that right?
Yeah. Yes, I apologize for that. Yeah, Healthcare Without Harm is a global organization. We have branches in 4 continents, and our reach is tens of thousands of healthcare facilities in, I think, 72 countries around the world. the global equivalent of Practice Green Health is called the Global Green and Healthy Hospitals Network. I can share a link to that. For people from Europe, Practice Green Health Europe has the Doctors for Greener Healthcare Network, which is similar to our US-based physician network. I can put my email in the chat. Please reach out to me, and I can provide you, regional contacts or resources.
Great. I'll turn it over to you, Carly. How can folks get involved in your work?
Yeah, a couple specific opportunities. If you're a student or if you work with students, would love for you to lead a planetary health report card for your school. We actually just had our orientation last weekend, which was recorded if you missed it, and we're gearing up for this year. So would reach out on the sooner side if you're interested. And as I mentioned, we have report cards for medicine, nursing, and pharmacy. So if you're from those disciplines, there's a little bit more of a paved path, but we're also working on report cards for physiotherapy and dentistry, as well as possibly in the works, graduate medical education and undergraduate degree programs, if you would like to contribute to that metric development and implementation. And then, am I good from a clarity standpoint? Should I talk about video again? Awesome. Finally, it's working out. And then two, I imagine most of you are on the GCCHE mailing list, given that you're here, so might have already heard about this, but the Climate Resources for Health Education Initiative, which is an open access repository of expert reviewed cases and slides spearheaded by Natasha Sood, and is a collaboration between MGH, Brigham, UCSF, Emory, and the Global Consortium, is always looking for new content creators. It's a work in progress. So if you have just a few hours that you'd like to donate to helping develop educational materials and doing a topic deep dive, helping in a very concrete way, I think it's a good opportunity. And then more broadly speaking, in terms of what opportunities I see emerging in the future, I think in the last 5 years, there's been a big push to integrate climate and health into health professional curricula. But what I still see missing, at least from my limited vantage point, is more of a translation of that education to the clinical environment. So how do we give practicing healthcare professionals the tools to have conversations with their patients about climate change and health? And how can we spearhead large-scale quality improvement projects in our hospitals and clinics that center sustainability? So I hope that there will be more opportunities, initiatives building along those lines. And I know Dr. Collins in particular has been spearheading a lot of those.
Great. These are all great opportunities. And Lori, any opportunities you'd like to add from your end?
Well, the great thing I think is that there's something that all of us actually enjoy that we can do in the climate movement. So if you hate public speaking, you don't ever have to public speak, and you can still be a superstar in climate change work. If you don't have a state group, you can work with the MSCCH like they've already discussed, but you can also represent the health voice with local nonprofits. We know that there's health benefits as well as greenhouse gas lowering benefits to promoting local foods, to regenerative agriculture, to active and public transportation, to increasing renewable energy locally. And by adding our health voice and health impacts when these groups apply for grants, they're much more likely to be successful. Linda Rudolph spearheaded a concept called Health in All Policy about a decade ago. This really applies very well to climate action. So I venture to say that all of us have a passion in at least one of these fields, and we can act as the health voice locally.
Any advice for folks that are just starting out in the movement? And it can be anything ranging from professional to personal. And Armin, I'll start with you again.
I would say just start where you are with what you have. In the guide that I posted, there are some really concrete things that you can outline, that you can pretty much do from where you are. For example, if you work for an FQHC that is in a disaster related area, whether it be flooding or hurricanes or what have you, asking them how, or helping them to implement some sort of plan, not just for individuals who work for the organization, but also for the communities that they actually serve as well. I would say that's probably the most important thing, urging your university, your FQHC, your federal grant site, to come up with some sort of plan to address individual populations, not just when it's sunny outside, but also when it's a disaster too.
Great, thank you for that advice. And how about Carly next?
I think the great thing about the climate movement is that there's a space for everybody. There's a niche for everybody. We don't all have to do everything, but we all can do something. In addition, I would say that though it can feel like climate change is so a massive and devastating,
You might want to turn your
we possibly can to tackle it right now. Okay. Sorry. This is a marathon and not a sprint, and you're so much more powerful if you can give a little bit for a long time versus being a bright light that works for a limited period and then burns out. So it's okay not that you can realistically donate ebbs and flows, just about how you can make that time most impactful and how you can target your energy most appropriately. And often that means working with your local community. There's that pithy phrase, think globally, act locally, but even if it's a little bit overused, I think it's true.
Very true. Also great advice. Lori, how about you?
I guess just jump in and find a tribe, even if it's just one other colleague or your significant other. It could be somebody nearby or virtual. It really helps to have somebody to bounce things off of and gain strength from. But as soon as other people know that you're concerned, there's going to be more opportunities arise, more than you can even take advantage of. We have so many doctor specialties that have created climate groups. Amy organizes a lot of these with dermatologists and radiologists and ophthalmologists. So you can start small and start with a group of half a dozen people in your specialty, wherever you are in the world, and it's going to grow organically. I would like to challenge the non-pediatrician healthcare providers to consider a way to make state representation in climate change possible through your national organization. We think it's a replicable model, but we haven't had anybody replicate it yet. Thanks a lot.
Because there's only one Lori Byron. How about you, Amy?
I think it's a great question, and it's one I get asked frequently. It's one I'm actually talking about tonight in another panel. But I think that if you want to get, if you're interested in sustainable healthcare and that is going to be your path, the first thing I would recommend doing is getting educated. Learn about the climate and environmental impact of healthcare and opportunities to decrease it. If you're interested in some resources, please reach out to me. And I think once you get educated, you educate others. Have these conversations during rounds, educate your colleagues, do a grand rounds or bring in a grand round speaker, do a departmental a talk. So, that's the first thing. I think you need to get educated, then own your education, your knowledge, and share it with others. And I also encourage people to connect with the sustainable healthcare community. I welcome any of you who are interested in this to join our Healthcare Without Harm Physician Network. As I think Lori just mentioned, we have a number of cohort groups for radiologists, surgeons, OBGYNs, and physicians in training. We have, journal clubs, an educational program, a virtual ground and ground series. Many ways we support our members, but I think there's an incredible value of being part of a community, a networking and learning community. When you're in the healthcare setting, look around for impacts and opportunities. I promise you that once you start seeing them, you're not going to stop seeing them. So I think, it's a good way to just understand the magnitude of healthcare's environmental impact is just looking around during your day-to-day clinical practice. And talk about climate smart healthcare. I can share several examples where medical students have spoken about their interest in climate smart healthcare during residency interviews, and it's actually led to something happening. So I always tell students, to sort of realize you have power and talk about this. And finally, I encourage people to commit to one action. I usually end my presentations with reflecting back on my story. It was one teacher who read a story about climate change, who inspired one little boy, who inspired one mom. And then I was able to easily inspire my CEO, and it eventually led to this, physician sustainable healthcare movement. So never think that one action isn't going to lead to something bigger.
Such wonderful words of wisdom from all four of our panelists. Thank you so much. And now we just have a few minutes. I've seen some questions in the chat here, but it looks like some of them have gotten answers. So do folks want to come off mute and ask any additional questions to our panelists? Or throw questions into the chat? Oh, go ahead. Folashade, is that how you say your name?
Yeah. So what I find challenging is that there are so many things to do, especially locally with environmental health. And there are so many different kind of competing interests. And I find that it's really hard to find the right track and find the right path to make what I feel would be the most impactful influence. And finding my people has been harder than I thought. So in what ways would you advise us to narrow our focus and to find our particular people? And I specifically am talking about on a local level, like on a city level, as opposed to a state level. Is that clear?
I remember Carly echoing this similar sentiment. Carly, do you have any advice for Folashade?
I got advice
You might want to turn your camera.
from someone that really resonated with me. It was like all of the change. Okay. Some advice I got from a few weeks ago that really resonated with me was that all change happens by showing up to boring meetings. There is so much that happens locally that takes place as a result of boring meetings where often people don't really show up. And so you have a lot more of a voice as a result. And I imagine it's kind of a two birds with one scone situation where you not only are able to make a difference, but then also finding other people who are also showing up to the meetings and finding community that way. But would be curious what others have to say.
Yeah, I'll also say that really quick, that I would say most of the things that are happening on the local level are the most important. So being able to engage with your local government on things, convincing them to do certain things on a local level are really going to impact the populations that are local as well. A lot of things that happen on a state level and on the national level are they can be inundating, they can be scary to get a part of, or they may just have places where you can't even get involved. But locally, and this is what I really talk about in the guide, is that the local efforts, even around things like disaster relief, disaster response, are the ones in which you can make the most impact.
Great. Laura, or Amy, anything to add? Right. Joseph, we'll take your question.
Can you hear me? Hello, can you hear me?
We can hear you.
Yes, I'm calling from the island of Grenada in the Caribbean. And I'm happy to be able to have been able to participate in this exercise. What I find very difficult is that even when you give information on the chat, it's very difficult for people like myself to be able to just write it in time or while listening to what is being said. Or sometimes like this evening, there's no way you could copy the information. And I think maybe you could consider that in the future, that the information are inaccessible, because for one thing, people in the developing world have a disadvantage in terms of information. And when we get access, when we have the possibility of information and you want it and you can't get it, it's a kind of frustration. Now, I'm not a physician, I'm an environmental activist, and I came through this through another program at Columbia University. And it's been very helpful in terms of from the medical point of view, because I've been involved from a climate change, justice, and a broader sphere. So having an understanding of the different dimension of the medical aspect, where as far as its effect on climate change has been very helpful to me, but I'm now being able to sort of be able to access a lot of the information which can be helpful in convincing the folks here. For instance, we have a medical school here, and there's little activity when it comes to climate change. I mean, if I have the information and others have the information, we might be able to convince them to get on board. So I just want to make that point. And I left my email in the chat. I wish other people could contact me. I'll be very grateful. Thank you.
And I'm really sorry, a power saw has just started behind me. And so I heard most of that, but Joseph, it sounds like Haley can drop some resources for you in the link. And now I'm going to turn it over to Nicole and Bev, because I'm not even sure if anyone can hear me anymore.
Yeah, that is a powerful power saw you got there, Lisa. Well, Echo, I appreciate your comments, Joseph. And at the consortium, you know, this program, this webinar series is really focused on the US and ways to engage in the US, but we do, Nicole and I will share soon. We have tried to link in some global resources as well, because we know there's folks joining from all around the world, and we know the climate and health movement is at different levels around the world, and you know, we want to support in the ways that we can, but we are a US focused group. So we want to kind of round this off here. We've heard from these really great folks who are doing fantastic work in these areas. And so we now, I'm going to let Nicole talk about this, but we want you to kind of take a step back as you're thinking about, well, where could I plug in from here?
And again, we'll also put a link in. There's a great TED Talk from the woman who created this Venn diagram. And I think it really is a great way to kind of think about and create your own approach to engagement. And sometimes we're like, well, what can I do? Well, everyone brings special skills to the table. We all have something, whether it's we're a good writer. Maybe you like public speaking. Maybe you're incredibly good at editing. You don't like writing, but you might be great at editing. And so one of the first things we encourage everyone to do when you're trying to find your space and your role is just sit down for a second and think about what are the things that you're good at and that you enjoy doing. And then from there, you can take a next step and you can think about think about it as a system level, like what are the things that need to happen? And we've heard some stories just from our panelists about this. You know, we heard about what can I do in the work that I'm doing? Well, I can work with my health system to address sustainability. We have another example of someone who took that approach. Our colleagues in Idaho, it's a state that is often seen as very, very red with limited opportunities to push climate action forward. But an area where they could work was looking about sustainability in their health system, and they've had success there. So you can look at where there are areas of need. And then finally, you've heard from folks in our panel, you know, what gets you out of bed in the morning? What motivates you? We really encourage you to pick things that spark joy, because if you this is, I 100% agree. This is a marathon, not a sprint. And we have a lot of ups and downs. We've had some wonderful ups this year, but we've also battled some downs. And there may be more sad things coming our way. So you need to find the things that spark joy, that are going to keep you engaged, that are going to help you prevent burnout. And once we look at these three different categories, where you have skills, where you've identified a need that you want to engage in, and what are the things you bring that bring you joy, that centerpiece is where you should engage in climate action. And this is going to change over time. Your time is going to change. Your interests are going to change. What you can bring to the table will change. But when you marry these circles together, what you bring to in the center of that is incredibly powerful. And so I really love this diagram, because I really think it helps you kind of map out a journey, or at least the start of your journey, or even if you're in the midst of your journey, where you might take that. So Bev, let me turn it back to you.
Yes. So what we're going to do now is take some time to actually think this through. We know that by charting out, taking some time to actually ask yourself the question, you know, what are my concrete next steps, and writing them down, or starting to do them, you're much more likely. It's really hard. We're all, have a lot of things we're concerned about and active in, but figuring out what your next step is to find that climate and health community, or to be more involved in a way that is right and authentic for you. So we are going to go into breakout groups to answer some questions, and to support each other in thinking these things through and concretely getting some next steps here. So, we just showed that Venn diagram. And so the first question is and I'll drop all of these in the chat. So what work are you most excited about doing in the climate and health movement from what you've heard today? What stood out to you as, oh, actually, that's really interesting to me. I want to get more involved in that. Or, oh, I've heard, I didn't know that these state level groups existed. I'm interested in hearing more or learning more. And then what are your steps to get started? What information do you need to know? Where website do you need to look into in order to do that? And there's a lot of things you can do as individual actors that you've heard, but I would really pitch the way to really sustain emotionally and spiritually, and just at a level of being able to continue advancing in this work, being a part of a group of people doing it is a really powerful thing. So, and I will drop these in the chat. And I'm also going to share, let me just bring this up. We created a Google document with some links to the things that we have been discussing today. So some of those groups. So I'm going to drop this in the chat as well. And so if you're at a place where you're needing to follow and subscribe and learn more about these issues, I have dropped in here some of the key newsletters I'd recommend, as well as our organizations to follow on social. I put the Twitter in here, but all of these are also on LinkedIn, and I think some of them have Facebook, whatever your decision is. And then places to join and engage. So I am going to drop all of this in the chat right now. And then after that, Carly is going to send you into breakout rooms. So, okay, let me just do this. Got lots of screens open.
Let me just say quickly, I didn't get to say before, thank you so much to our speakers, Lori, Armin, and Carly. We really appreciate your perspective. So thank you. And Amy. Interesting that came out. Anything interesting that came out of your discussions? Any concrete action points or inspirational things that you heard in your conversations? No one? Anyone?
Okay, I'll share that I got to have a really lovely conversation with Karen, who is newer to the climate and health world, but is trying to figure out setting up a workshop within the American Medical Women's Association. So I was able to give her connection with our connection there as a consortium, and then let her know about the California group, which is her state group. So I think she has a bunch of tabs open right now for some concrete action steps.
Great. Anything else come out that folks want to share?
I also made a referral to Climate Health Now, and also talked about Schools for Climate Action, because we have some folks that are engaged in health education work in schools, and that's a wonderful group that is doing some amazing work. So just fun to chat.
Great. All right, well, next week is our last session, which we're super excited for. And in the meanwhile, I think the recording will be available probably sometime later this week. And we're looking forward to seeing y'all next week. So thank you so much.
Thank you.